Vanakkam, Namaste and welcome to Dr. Shah's Clinic. Now in this video, we are going to discuss another very common clinical condition that we are seeing increasingly today in the typical andrology practice, and it's called buried penis. So how do you treat a patient with buried penis, and what is actually a buried penis? Now a buried penis is a condition where some patients, the organ is so deeply embedded in suprapubic fat that the organ is almost invisible. So what happens is in some individuals who are morbidly obese, or in some individuals who are very fat, what's going to happen is fat is going to be deposited in the prepubic or the suprapubic region of the body, that is in the place that is behind where the penis is actually located. And when the fat deposits over there, it's going to cover up the organ. And I've shown an image on the right hand side. If you have a look at the image, you can see that you can see the image of a normal prepubic fat area with the penis that is completely exposed, as well as in another case of a buried penis where you can see the penis is completely buried inside, and because of the suprapubic fat that's actually covering up the organ. So in some patients who are very morbidly obese, and in some patients even with some patients who have a condition called hypogonadotrophic hypogonadism, patients can usually have, some patients can have this condition called buried penis. Now, what are the symptoms of buried penis? Now, symptoms of buried penis that have usually been reported in the scientific literature include difficulty while passing, difficulty in voiding urine or passing urine, because what happens is, because the organ is so buried inside, the penis is so buried inside and covered by suprapubic fat, urine usually sprays for the patient. Patients usually find it very difficult to even stand and void urine. Patients also report severe erectile dysfunction and difficulty in having penetrative sexual intercourse. Yes, that's another major problem that's seen in patients with buried penis. So if the penis is buried, patients report two cardinal symptoms. One is difficulty in voiding urine, and number two, they have difficulty in having a healthy, regular sexual life, mostly with sexual penetration of their partner. So how can buried penis actually be treated? Now, there are a lot of other conditions that have to be ruled out if a patient is diagnosed with buried penis, because what basically happens is, because the organ is buried inside the fat region, certain other clinical conditions that are seen associated with the buried penis include conditions like chronic obstructive pulmonary disease, presence of associated diabetes, presence of dyslipidemia, which is basically high cholesterol, and another inflammatory condition called lichen sclerosis, which has to be ruled out. And a thorough physical and clinical examination has to be done for all patients, along with appropriate blood testing for patients who have the organ that's completely buried. So these are some conditions that have to be ruled out, include conditions like lichen sclerosis, hidradenitis suppurativa, and there are a lot of conditions in the literature that have been associated with buried penis. They all have to be systematically evaluated and also taken into consideration, because buried penis is not something that can be easily managed. So what are the management options for patients who present with this particular buried penis? And the simplest and probably the most easiest management option is basically going for a very, very active weight loss program that is tailored towards the lower body. So what happens is, because the organ is buried inside the prepubic fat or the suprapubic fat, that particular region of the body, the fat has to be burnt out by regular healthy exercise. And what basically happens is that itself will basically allow the organ to be exposed outside, and to some extent further treatment strategies can be instituted for the patient. So weight loss is usually the first treatment for patients who have buried penis. In addition to that, other associated conditions like if diabetes is present, diabetes should be treated. If cholesterol is there, cholesterol should be treated. The patient should be put on a healthy diet and healthy lifestyle management. Healthy lifestyle management strategies have to be advised to the patient. Not just that, if the patient has this condition called lichen sclerosis, we really do not know why it happens, but we just know that it happens in patients with buried penis. That should be treated with basically steroid creams like clobetasol cream, and steroid cream has to be used for treatment. And COPD also has to be managed. That is, COPD is nothing but chronic obstructive pulmonary disease. Because of the morbid obesity, Patients may have breathing difficulties. Patients with buried penis may also have breathing difficulties. That should also be managed concomitant. So it's basically a multidisciplinary approach to the management of buried penis. So we try to treat all the associated conditions that may present with buried penis. We investigate and treat. And also what we try to do is advise the patient active weight loss so that the organ which is buried is actually comes out. And after that, what's usually done is the suprapubic fat has to be removed with the liposuction. They normally, a plastic surgeon and the urologist usually work together as a team, and they do a procedure called panniculectomy along with a split skin graft. So what happens is basically the excess fat is basically drained out so that to release the organ. And if there is excess foreskin, because what happens is because the penis is buried inside the prepubic fat, the skin may be excessive. The foreskin that covers the penis may be excessive. So a circumcision is also usually done so that the glands can be exposed. Now, what's also not surprising to note is that sometimes when the glands is exposed, patients with buried penis may have hidden urethral strictures. Now that's a major problem because we really do not know why urethral strictures develop in patients with buried penis, but urethral stricture is a major impediment to urinary hygiene in general. So if there is a urethral stricture, further evaluation should be done with imaging studies, as well as something called as a cystoscopy, where with the urinary bladder and the portion of the stricture should be clinically imaged and assessed. So buried penis is definitely a complex problem. I know this video does not I cannot tell everything in one video, but this is a brief overview of buried penis and the associated clinical condition with buried penis, and as well as we have also highlighted some treatment strategies for buried penis. So I hope you found this video interesting. Do share it with all your friends and loved ones where relevant, of course, and keep watching this channel for more interesting videos. This is Dr. Shah. Vanakkam and Namaste.